And I'm once again Laszlo Medeiros. I'm the Chief Medical Officer for Migrant Clinicians Network, and it's my honor and privilege today to be the MC for the second annual Kugel Zuroweste award ceremony. And I have the privilege of showing us both the names of the people who have the award named after them, Candace Kugel and Ed Zuroweste, and also Paulina Segovia, the winner of this year's award. So first, I'll let you know a little bit about my colleagues and friends, Ed Zuroweste and Candace Kugel, as I've known them for many years now, and it's after them that this award is named. So I'll start off with first topic here. We were once young, and we were migrant clinicians for many years, and once young. We're still migrant clinicians, but we want to honor the younger generation of clinicians who are coming up here. So I wanted to know that I've been working with Ed Zuroweste and Candace Kugel for about 25 years. And they hired me out of residency. That was my first job. And I met them in South Central Pennsylvania, where Ed was the director of a community health center in South Central Pennsylvania, working with rural farm workers. So Ed had worked for many years as a farmhand in Ohio growing up. And later on in his medical education, he worked in Mexico. And he's been working with farm workers in a strong passion to continue caring for farm workers as he was working in the United States later on. And so Keystone was developed with the idea of helping immigrants and farm workers at our community health center. He has been the medical director there for many years. He was the founding director of not only MCN, but also of the Keystone Health Center. And there he's been a wonderful friend, a boss, a colleague, sometimes kind of the older brother that I wish I had. But we've been together for many years now. Candace has been a family nurse practitioner and a nurse midwife for many years. She also worked at Keystone for many years, and I've worked with both Candace and Ed in Honduras also, teaching midwives, medical students, PAs, and others in medicine. Candace has been a real inspiration to me in many other ways too. I worked with midwives in West Africa when I was a medical student, and it was through their work, their teaching me, that I changed from med peds to family medicine OB and started that residency instead of what I'd planned originally, thanks to midwives. And she has been a wonderful mentor to me as well. One of the things that you have to know about Ed and Candace, and I realized this when I first started working with them, they could walk into any situation, any kind of frantic medical situation, a dumpster fire, whatever, and they'd walk into the room and immediately the room would calm down. And that was true, in the clinical exam rooms, in the emergency room, and in the delivery room, because their patients trusted them, and the nurses trusted them, and the community of the hospital staff trusted them, because this is the kind of people that they were. They could walk into a situation, take control right away, everybody calmed down, and things would happen in a very calm way. So I've always appreciated that also about them, that they could do this kind of work. And they taught me and many other medical students, residents, and Ed also handpicked several of the people who still work in the community that I work in South Central Pennsylvania. And many of them had stayed now for 20, 25 years. So he's been a mentor for many generations of residents and students, as was Candace. So this award, this Kugel Zuroweste Award, is a tribute to a new generation of clinicians, rising stars that we consider, who have already made contributions to their community and will continue to make significant contributions and impact in the lives of their patients. So we celebrate this second year of a rising clinician. And so I want to go from here to just talk about the Kugel Zuroweste Award and then introduce our award winner. So the Kugel Zuroweste Award was established in 2020. It's an annual award with a prize of $1,000 that recognizes frontline clinicians making an impact on the intersection of health, vulnerability with the migrant community. And we had last year, we had a wonderful candidate, Caroline Johnson. Unfortunately, she can't be here today, but you'll hear her in a taped message soon here. So she was our winner last year, and she'll be talking very shortly here too. But this year's winner is Paulina Segovia. And I had the privilege of interviewing her and meeting her last week. And I had a wonderful time getting to know her a little bit. I'll just tell you a little bit of the background. She says she doesn't like to talk about herself, so I will. Her family, her grandparents came from Italy. They were fleeing Mussolini's Italy of World War II. They moved to Mexico. Many of them were physicians themselves. And then she was able to grow up in Brazil and the United States, travel to Mexico, learn Portuguese, Spanish, and English, and maybe other languages I don't know about, but she had a very interesting background. She went to Purdue University and studied biology, chemistry, and nutrition. She became a nutritionist and got further studies in Lexington, Kentucky, doing an internship there. And then University of Indiana, she was a dietitian there for the surgical department. And she decided she wanted to do more with clinical work. And so she went to a PA program, Red Rocks, and graduated in 2020 from that program. She then went to Denver, Colorado, where I believe she is still working at the Tepeyac Community Health Center, where she got very glowing reviews recommending her to be this year's award recipient. And Ed and Candace looked at the candidacy and just said, "My goodness, this is the person that this was designed for." And having met you, I just felt like they're absolutely right. You're the perfect person to get this award. So the second annual Kugel Zuroweste Award goes to you. And congratulations, Paulina. Okay, so from here, I think we will go now to the taped comments and recommendations for you. And then Ed and Candace will have a little something to say too, Paulina, and then we'll listen to you. And then from there, we'll just have questions and answers and whatever else. And then we'll close from there. Ashley, was there anything else that we could do? Could we start the videos?
I think we will be able to. Giovanni, are you ready? And thank you, Les. Excellent opening comments as always.
Yeah, you're with a great group of people here who support you. We are your tribe. Paulina.
Yeah, I'll go ahead and start the video now.
Thank you.
How's the Spanish interpretation going?
There's not any sound, Gio.
Did you share did you click the with sound button, Giovanni?
I'm Valenza. I am a family physician and I am the Chief Health Officer at Tepeyac Community Health Center. And I am the individual that nominated Paulina for this award. When I first read about the award through a newsletter that came through my email, and I was reading through what the award was about and recognizing a rising star hard at work in the work of health justice and health equity, who was on the front lines, and they talk about the intersection of health and vulnerability within a migrant or mobile population. And I immediately thought of Paulina as somebody who would not only be deserving of this award, but also really exemplifies what it means to be a frontline provider within a migrant or immigrant community. At Tepeyac Community Health Center, we have been in the community for almost 30 years. We provide integrated physical, dental, behavioral health to a number of individuals across the Denver metro area. And we have a predominantly Spanish-speaking, underserved, largely uninsured population. And as an organization, we really pride ourselves on our mission and our dedication to eliminating health disparities, especially within our specific community among the Latino and immigrant community. And we have, in general, an unwavering commitment to patient care, to effective patient care, continual quality improvement, and the consistent treatment of each patient with respect and dignity and compassion. And so I first met Paulina when she was a student, a physician assistant student that was rotating through our organization. And when I first met her, it was a very early clinical rotation, but she was really excelling clinically, academically. I could tell she was a strong student. And really through her identity as a Latina, she came into the rotation excited, connected incredibly well with our patients and our staff. She was personable, she was approachable, and she was very professional with everyone that she spoke with, whether they were a staff member or a patient. She really never failed to take an extra moment with those patients. She was really interested in learning the socioeconomic barriers that patients were facing and understanding what it was that she could do, even in her role as a student, to impact that patient's care and to progress their level of care. And by the end of the rotation, it was very clear we had a number of staff members who really just loved her and wished that she would come back. And we were thrilled when she decided to come back to our clinic for a second rotation at the end of her training. And really at the end of her second rotation, at the beginning of her second rotation, she was functioning as an independent provider. She was continuing to build relationships with our patients and with our staff. And really, I honestly can say that within my 10 plus years of experience working with students, Paulina was by far one of the strongest physician assistant students that I have ever worked with in the last 10 years. Really, she stands out clinically. She pays attention to the small details while still moving through and assessing the bigger picture. She really has a lot of inherent qualities that I'm hoping to relay today to you that really make her a stellar provider. I can say that she is genuine and thoughtful. She is compassionate and observant and truly a strong advocate for underserved care and serving the community from which she comes. And I have to say, being a healthcare provider within a migrant, immigrant, or underserved community can be challenging. We know patients are experiencing a number of undue stressors, that there are a lot of barriers that our patients are facing that are in fact much higher than certain other communities or populations. And so it really takes a special provider and a special human and to continue the hard work and really continue the hard work with a smile on your face and passion and to really be engaged and committed to that work, because it is work. And especially during the pandemic, we know there's been a lot of burnout within the medical field. As a testing center here for COVID, from the very beginning stages of the pandemic to being a COVID vaccine site, we have seen a lot of undue stressors in our patients, and really stressors that have been existing prior to the pandemic really compounded throughout the pandemic. And Paulina has really stepped up to that challenge, especially as a new provider. She did join our practice just December of 2020. So she joined and rotated at our organization during the pandemic. And I've really seen her grow and move into being a new provider in a set of undue circumstances that really were not expected. And so I have to say, with the challenges of being a new provider alone, being a new provider in a community health center that serves a large percentage of uninsured patients, and being a new provider within a pandemic, she really has gone above and beyond what I could have imagined when she first rotated with us. She comes to the clinic every day filled with passion and energy and enthusiasm. She has developed a number of different online materials and teachings and educations for the Latino Spanish-speaking community. She has participated on a panel to discuss the importance of achieving health equity and really how she provides care as a bilingual, bicultural provider, and really advocates each and every day to provide the best care possible for our patients. She has spent uncountable hours coordinating care for our patients who are getting denied services at other health centers or specialty care centers, really speaking to patients on the phone to make sure they understand a treatment or a referral. She has been involved in community outreach and engagement. And so when we think about a provider who is providing care and the provision of care, she goes beyond just providing that care. She has a lot of extra. She is well above and beyond in a position to, as she moves forward into her career, provide lasting systems change if she continues on this path with her passion to serve the community and with her enthusiasm and her camaraderie. And she never once hesitates to ask for support or feedback to continue her own professional development and self-development. And so I really want to say that Paulina is an excellent provider. She has excelled within her field as a clinician. And really, when we talk about the front lines of public health and health equity, she is a public health practitioner in that respect, in that she goes above and beyond to really coordinate and collaborate for the care of her patients. And her dedication to working in the underserved community really has put her on a path that I think she'll continue to shine as she moves forward and progresses and grows. And I'm really hopeful and happy to see how she progresses as a clinician. And I think we're very lucky as a health center to have Paulina as one of our providers. And I hope you understand that from all the videos and support that Paulina has today, that our staff members and her friends and family have been able to share. And so I'll end it with this, that when I spoke with the program director at Paulina's school about her coordinating her rotations at our health center, the program director had said, Paulina is a gem. She's truly one of the best. And I could not have said it better. Thank you, everybody. And congratulations, Paulina.
I'm so honored to have the opportunity to congratulate Paulina Segovia as the recipient of the notable and prestigious Kugel and Zuroweste Health Justice Award. Paulina really embodies the spirit of this award as she consistently works to provide high-quality medical and psychosocial care to our patients at Tepeyac Community Health Center. Not only is Paulina a nimble problem solver, able to think quickly on her feet, she manages to also balance these needs of a high-pressure clinic job with empathy, calmness, and devoted care to our patients. It is clear that Paulina does not see her role at Tepeyac as just a job. To her, it's a vocation, rooted in the vital need for justice to be intimately linked to healthcare. I've worked with Paulina first as a preceptor when she was completing her PA rotations at our clinic, and now as a colleague. Our clinic is small and fast-paced, and we typically do not extend offers of employment to newly graduated clinicians, but Paulina was different, and we knew that from the start. Her confidence, her deep wealth of knowledge, her willingness to learn more, and ease by which she flows in and out of conversations with patients and coworkers are invaluable skills. From her first rotation, it was clear that Tepeyac was her home. She is a humble leader at our clinic, advocating for not only our patients, but also her coworkers. She cares deeply for her colleagues and is often the biggest cheerleader for clinic staff. Also, her experience in her previous career as a nutritionist has allowed us to provide diabetes education classes to patients, promote the formation of a nutrition team here at Tepeyac, and has given us many opportunities for education among staff during clinic meetings. Not only is she all the excellent qualities that I just shared that makes her such an incredible asset at our clinic, but also she's just really fun to be around. She has a great sense of humor. She speaks often in sound effects rather than words, which I get a kick out of. She always has entertaining stories to share about her childhood, whether in Mexico, Brazil, or Indiana, and she has been a huge hit at our house with my kids. My 3 sons consider her an always welcome person in our home, and well, I'll leave it to them to share how they feel.
I love you, Paulina. 1, 2, 3, go. 2, 1. We love Paulina. Paulina. We love Paulina. Paulina.
Go, 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 Paulina! Nope, that's upside down word. Okay.
I love you, Paulina. We love you. Congratulations. We love you, Paulina.
Hooray!
3, 2, 1. I love you, Paulina. We love you, Paulina. Congratulations, I hope you like the award.
Yeah, you did it.
As you can see, we are so proud to have Paulina as part of our team. Thank you again for giving me the opportunity to share much deserved praise of Paulina. Paulina, we're just so proud of you. Congratulations on your award. Thank you.
Hello, my name is Patrick Huffer. I am a physician at Tepeyac Community Health Center. It is my great pleasure and pride to congratulate Paulina Segovia as this year's recipient of the Kugel and Zuroweste Health Justice Award. I can think of no better or more deserving candidate than Paulina. Her current work at Tepeyac Community Health Center exemplifies the spirit and mission of this award by providing medical care to some of our region's most underserved patients. Without hesitation, I can say that Paulina is one of the most talented and caring people that I have ever met in any level. We first got to know Paulina when she started rotating at our clinic as a physician's associate student. It was clear from the onset that she was not just any student. Her easy rapport and confidence with patients quickly earned her respect from patients and staff alike. Within a few short weeks, patients were referring to her affectionately as La Doctora and were requesting her for their follow-ups rather than the rest of us as their primary care physicians. It was then our great fortune that Paulina chose to do a second rotation with us during the height of the pandemic, and then shortly after graduating, she joined us full-time as a physician's associate. In title, I'm supposed to be Paulina's supervising, mentoring physician, but as is often the case with supremely talented learners, I feel that most of the time I actually learn more by observing Paulina than she ever picks up from me. To watch her meet with patients is to see compassionate, patient-centered care in action. All of the tangible and intangible things that a really good medical provider does, things like sitting down with the patients, understanding when the power of touch is going to be useful, when it's not, how to be silent when other people might not be silent at that moment, using teach-back to make sure that there's comprehension of difficult subjects. All of these things Paulina does instinctively. I really didn't have to coach her on any of these things. Paulina's patients know that they have that rarest of entities, which is a medical provider who is really, truly present with them. That's not to say that Paulina's first year of practice hasn't been very easy. Besides starting her career during the ever-shifting territory of the COVID pandemic, Paulina has had to deal with a much higher than average caseload of new cancer diagnoses. Learning how to impart these devastating diagnoses to people compassionately and with inspiring confidence was a challenge that she undertook with real learning. Oftentimes I would watch her spend hours on the phone calling specialists and arranging care, usually after cancer centers had denied her patients coverage due to lack of insurance or other reasons, or when our referrals coordinator had reached dead ends in terms of where else to refer them to her. Thanks to Paulina, there are many families who were on the verge of accepting that their loved one would die without receiving treatment, who are still enjoying the company of their loved one. Paulina is really, truly a rising star in primary care and in family medicine. She often says that she likes working at our practice because it feels like home to her, and I'm certain that her patients say the same of the care that she provides to them. I'm so pleased that she's been recognized for her hard work and her passion that she brings to this field. I know that she will continue to do great work, and the world is certainly a better place for it. Congratulations, Paulina.
The very first day that I met Paulina was likely an extremely stressful day for her. It was the day of her PA school interview here at the Red Rocks PA program. By a totally random assignment, I was the one who was lucky enough to get to interview her. We had gotten approximately 2 questions in when I knew that the world needed Paulina as a PA, and 2, selfishly, I really wanted her at our program. Her infectious personality, her background as a dietitian, and her obvious compassion for people was really compelling. And I knew that she was someone that I was willing to fight for, to make sure that she got into the Red Rock. Fortunately, I didn't have to fight any of my colleagues because they were all equally enamored with Paulina as I was. And Paulina began her PA school journey here at Red Rocks in August of 2018. From the very beginning, she was incredibly humble, always open to learning, compassionate, displayed the utmost professionalism, and was somehow cheerful no matter what situation she was up against, and also had a great global understanding of what a patient might need to receive quality care. We know that when patients receive care from folks who share their cultural background, language, and look like them, they trust their providers more and the outcomes are better. And we are so glad for all of the work that Paulina has done at Clinica Tepeyac. Speaking on behalf of every faculty and staff here at Red Rocks, Paulina, we are incredibly proud of you. And we know that even more great things are to come from you.
Hello. Thank you so much for giving us the opportunity to talk about Paulina. Paulina is my daughter, and we are very proud for her nomination and award, and that reflects basically her devotion to help and to serve others, particularly the ones that have no luck or resources as many of us have had. Paulina has been a very strong leader in our family, always bring us to recognizing everything we have and recognizing what we should give to the others. We are very proud from the time that she was in the university and was honored as Student of the Year, and then in her PA school, she was awarded with the Mission Award. All of that reflects her passion to help and to serve others. We are very proud of her and we love her so much. Thank you.
I'm Caroline Johnson, the winner of the 2021 KZ Award and the Clinical Director and Nurse Practitioner at Proteus in Iowa. I am so excited to help congratulate Paulina on her award. With all of the chaos and instability in healthcare over the past year, this award was the push that I needed to remember that while the path to advocacy can be challenging, it is our responsibility to continue to show up like our patients who continue to show up day after day to do the essential work of feeding our nation. Because of Candace and Ed's encouragement, I was motivated during the past year to publish our work and contribute to the limited pool of research on migrant farm workers in communal living settings, something I never anticipated happening in my career. A perfect example of why recognition from your peers in this award is so powerful. I am honored to be part of the celebration for Paulina. As part of the selection committee, when I read her nomination letter from Dr. Valenza, I sensed she was a star in the health center as well as the community. Her ability to connect with patients and team members, especially as healthcare workers face significant burnout after the pandemic, is incredibly important. Dr. Valenza wrote that she is clinically strong with attention to detail, but also able to understand the bigger picture, which so often is where the solutions are. I was also impressed by Paulina's impact within her organization and with her patients. Dr. Valenza mentioned her active role in process improvement, her community outreach and engagement, the creation of patient education materials, and her work to address vaccine hesitancy and answer the community's questions about the COVID vaccine. All of these things speak to her dedication to lasting systems change, which is really what is needed to eliminate health disparities and their impact on marginalized populations. Paulina, congratulations. I hope you enjoy this award and welcome to this prestigious club of two. Best of luck. Keep up the good work.
I'm Karen Mountain, and I have had the distinct honor of being the Chief Executive Officer for the Migrant Clinicians Network for the last 35 years. And one of the most exciting and happy moments that I have these years is to be a part of the Kugel Zuroweste Award. The Kugel Zuroweste Award is really the soul of the Migrant Clinicians Network. And it is the legacy of two of my personal heroes, Candace Kugel and Ed Zuroweste. This award typifies their career and their commitment to the underserved. It is in celebration of these two individuals who, of course, chose to give back. And it is through their decision that we are celebrating young leaders. What a wonderful idea. Look for someone who is in the first 5 years of their career, who's really, really making a difference already. And let's celebrate them now. And so that's what we're doing through Kugel Zuroweste. And it's so typical of Ed and Candace. It is so typical of their giving nature, of their tenacity, of their impatience to do more and to do the right thing. And that's, I think, what we will celebrate as we are during this award for Paulina Segovia. Paulina Segovia, what a great name. She has a great smile, and she has a wonderful mission, and she's already proving that she's a born leader and someone who's born to care. Just like Ed and Candace, Paulina's going to be one of us. Thanks.
Okay, wow, wonderful. That was really beautiful. Thank you, everybody who participated there. Yeah, I don't think there was many dry eyes here. We're going to go on from here to hear from Ed and Candace, and you're on, my friends.
All right. As the Kugel part of the Kugel Zuroweste team, I am a little overwhelmed. Wow. Paulina, it is such a great pleasure to finally meet you and to formally present you with this award. I want you to know that selecting you was really not difficult for us, since your background embodies the qualities we look for in our selection process. Like Caroline, you are what we call a rising star, someone who has not only committed to working with the underserved, but who has already made a mark early in your career. As all the people we just heard from have mentioned, you have already become a nutritionist and a PA. Your personal and family history has shaped your path, and you're doing outstanding work in a setting that truly needs you. It appears, and we hope, that you're on the road to a long career of service. And we know that that work can be both very rewarding and also exhausting. So I remind you that you're now in the MCN family, and we will be there for you with resources, information, and support along the way. So welcome and best of luck to you.
Paulina, as the Zuroweste part of the Kugel Zuroweste Award. And just so you know, Paulina, Candace and I are in the same house now because we're spouses, we're married. Candace chose not to take my last name, which I think was a wise decision on her part. But we are married and live together and have been partners in medicine and in life for a very long time. And I am just overwhelmed as Candace is, and just hearing, and man, your dad just about killed me. You know, we have children your age, and oh my gosh, Mr. Segovia, oh, I know how proud you are. And as Candace just mentioned, you were an easy pick for us for this award and for our committee. And just so you know, it's not just Candace and I that make this decision. We have a stalwart committee, which included Caroline. And so you were the #1 choice for all of us. We're so excited and happy to know that there are young clinicians just like you out there providing excellent care to the population at MCN. And you know, we're now, MCN's 37 years old. We've always strived to assist in assessing quality healthcare for the individuals that we try to serve. And we remain committed to the clinicians just like you in providing, as Candace said, a medical home for you. You are now part of our medical home. And we want to provide any technical assistance you may need as you work through your busy days. So we've got your back, Paulina. All right. Please stay in touch with us. Let us know how we can make your life and the lives of the individuals that you serve just a little bit easier. Congratulations. I'm just overwhelmed with happiness.
Great. Thank you, guys. So we're going to get on the next clip just in 1 second, but what I've learned from many years of studying at the MC school, how to be a good master of ceremony, one is to wear a festive shirt. Another one is to save a story in case there's techno glitches coming along, but it looks like, you know, knock on wood here, we have no techno glitches. So I want to save one story that really resonated with me, Paulina, as we were talking. That was your physician grandfather who saw people in their homes, in his home, and brought them in, and they were worried and scared and sometimes in pain when they came in, and they left the office, they left the home, you know, smiling and relieved. And you thought that as a young child, seeing your grandfather there, that was a magical transformation that you saw happening to patients, that motivated you. So that was some of the story that really resonated with me. So I just wanted to share that with you because that was wonderful, among many other things that I learned about you. So thank you very much. And with that, I think we can go on to the next tape.
Hi, my name is Paulina Segovia, and I am a physician assistant and registered dietitian, and I am honored to be the second recipient of the Kugel Zuroweste Health Justice Award. I want to say a big thank you to Ed and Candace for not only championing myself as the recipient, but also for creating this award as it can help motivate and invigorate all healthcare professionals. I appreciate all the work that you have done and all the work that you continue to do. Thank you all for joining today in celebration. I can only speak for myself, but I do not do this work for recognition or promotion. It is difficult for me to celebrate myself individually, so my hope is that we can celebrate all health workers as we continue to navigate this pandemic. A little bit of background about myself. I am a first-generation American born to immigrant parents. My grandparents immigrated to Mexico during World War II, and I grew up traveling the world, living in Brazil and returning to Mexico as often as possible. My grandparents are a big part of why I work in healthcare and why I continue to be a hardworking, passionate individual in all the work that I do. My education is that I started my work as a dietitian graduating from Purdue University. I then worked at the University of Kentucky and did a dietetic internship working with veterans. And then I found myself at the University of Indiana working as a general surgery dietitian. During my time as a dietitian in Indiana, I began to notice that I had a passion for working with my community. I believe that for a very long time, I took speaking 3 languages as a normal for me, not something that is to be revered or to be used, and I took it for granted. I found that during my time as a dietitian, I constantly was seeking out patients that spoke Spanish, finding myself being an interpreter and helping those patients navigate our very difficult and challenging healthcare system. After being a dietitian, I got accepted by the wonderful team at Red Rocks, where I graduated with my master's in physician associate studies in 2020. And during my rotations, I found my calling. This is what brings me to discuss why I choose to work at Tepeyac Community Health Center. I found my calling because as working and being a student, I worked at many different community health centers. And while many choose to practice and help the underserved, Tepeyac elevates that to a different level. With our mission being to inspire health and well-being and humanity in our community through all life stages. And it is our vision that our patients have access to regular and ongoing healthcare, providing cultural responsiveness for trustworthy care that empowers our patients. Everyone at Tepeyac is phenomenal. I would also not be here if it wasn't for Dr. Valenza, who I want to say a good thank you for not only nominating me for this award, but seeing the potential in me hiring a brand new PA at the height of the pandemic in 2020. A thank you to my mentor, Valerie Paulson, who always advocated for me as I navigated PA school. And additionally, a huge thank you to Dr. Patrick Huffer, who is my supervising physician, who continues to provide support, but also helping me realize that I cannot take on everything. So I am so thankful for him, for Dr. Valenza, for Valerie Paulson, and a huge thank you to everyone at Tepeyac. The work that you do, having been a clinic and then a community health center with over 25 years of serving the Latinx community. And now as we open a new building, we are continuing to advocate for our patients. It brings me to why I work for this community and why I choose to work at Tepeyac. Working with immigrants is not an easy thing. It has its own unique needs. Helping patients navigate an already difficult healthcare system, the challenges of poor health literacy, as well as the barriers of a different language. Our patients have to deal with not only not being able to speak with their medical providers, but also the fear of prejudice, racism, and in some patients, deportation. While it has its unique challenges, it is also so rewarding, and it allows for creativity and for passion and compassion to be at the forefront of the work that we do. I choose to work in this community because it is as if I am working for my family, as if I am caring for my family. It does not feel like work. I want to advocate for this community, for this population. And it brings me to talk a little bit about why family is so important to me and why I do the work that I do. I want to take a moment to say a huge thank you to both my parents, Fernando and Paulina Segovia. Without them, I would not be the person that I am today. I would not understand the power of compassion, of empathy, and of challenge. They have worked their entire lives to pave the way for me to have what I now have and the ability to be able to take care of others. My grandparents are also a huge part of my life. And I want to leave you with this little anecdote of when I was younger. So both of my father's parents, my apologies, Fernando and Rosario Segovia, were physicians that studied, and my grandmother actually was one of the first female physicians to graduate the School of Medicine in Nuevo León. My grandfather is in large part why I do the work that I do, and why I choose this field, who, as many who are on this call know, that it is not easy. It has its beautiful aspects and also its very challenging aspects. But for me, what is so important is to remember the difference that we can make. And I saw that in my grandfather as a little girl of 6, 7 years old. So bear with me in my creativity and large mind back then. My grandfather was a general surgeon, and after retiring, he started to see patients in his home. And I will never forget seeing him taking the weight off the shoulders of patients. He wasn't doing surgery in his home. He wasn't doing anything like that. Oftentimes it was just listening or providing a kind word. And I'll never forget seeing patients coming in with this giant weight on their shoulders and then coming out and thinking, my grandfather is a magician. How did he do this? What is he doing? And it is that I hope in my plans for the future. I want to continue to advocate for my patients. I want to continue to work hard, which is something that my mother's parents taught me as they built their own business and cared for a very large family, Malena and Polollos. They taught me hard work can pay off. It can be hard, but in the end, it's worth it. My plan is to continue to provide cultural responsiveness as a Latina that is not only bilingual, but bicultural, understanding patients' backgrounds and being able to put myself in their shoes. My hope is to help Tepeyac as we continue to expand, bringing a new facility at 48th and Race in the heart of the Denver, Elyria, Swansea neighborhood. And I want to give a huge thank you to Ed and Candace for advocating for me to be the recipient of this award. Without their support for new providers as we navigate this difficult and challenging, but so incredibly rewarding field, this helps to invigorate us to work harder, to be better for our patients and for this community. As you heard, I am the sum of my experiences from my culture, education, family, and background. I'm truly grateful for this recognition, and my hope is to invigorate the next generation and continue to advocate for those that cannot speak for themselves. Thank you for taking the time to be present today.
Great. Wonderful. Thank you, Paulina. That was lovely. Since you're live, I want to give you the opportunity to add anything else that you might want to say here live. It's up to you. Love to hear your thoughts. Anything else that anybody else wants to say after that, we also welcome. We have a few minutes to continue.
I just want to say thank you for everyone that is on the call, and I appreciate everyone who has supported me in this journey and has spoken for me and talked about how great I am. I think I'll keep this recording forever, and anytime I'm down, I'll watch it again. And I appreciate everyone so much, and I am the sum of my experiences. I wouldn't be the clinician I am today without my education at Red Rocks or without the support of my parents and Dr. Valenza and Dr. Huffer believing me and Allison's kids cheering me on.
Great. Thank you so much. We also want to say at this point that we will be opening up the nominations for next year, starting in May, for the next Kugel Zuroweste Award winner. So if you have nominations, think about that, and we'll open that up in just a month. Okay, anybody else that would like to add any comments here? We have a little time here.
Did you want to speak, Paulina?
Mom, you can talk. My mom wants to talk.
Yes.
Yes, I just want to say that we need the recording because your grandmother takes classes to understand the iPhone, and he was stressed to be able to watch you. She's going to be so proud. And I am so proud that you have people around you that you can learn so much from. Thank you.
Thank you very much. Yeah. Okay. Anybody else?
I'll jump in. I have gotten to work with Paulina very closely these last 6 months, and it's been nothing short of a joy. Before the videos started coming in, I had an idea of how outstanding and exceptional Paulina was, not only from the quality of the letter, which P.S. Dr. Valenza, I know I've told you this, but I'll say it again. Your nomination letter was by far and away the best we've received in the entire 2 years we've been doing the Kugel Zuroweste Award. But I think even if you were not capable of being the wordsmith that you are, what Paulina brings to the table jumps off the page. There's a quote by Alice Walker that I like to use, which is, activism is the rent we pay for living on this planet. And Paulina, at this point in time, you're paying everybody's mortgage with everything that you're doing. The world is a better place because you're in it. And I feel that I've gotten to get just a glimpse of who you are. And it is really a beautiful thing. You're a beautiful person. And you've brought the KZ Award to a level that I don't think we anticipated rising to this early in it. But you have set a standard that we will continue to meet, and it will make all of us better as a result. So thank you.
Thank you, Ashley Michelle. All right. One other thing I just want to say, Paulina, when we were talking is that, you know, being able to speak many different languages is a real skill. But I think one of the real gifts is to be able to listen in those languages and to be able to hear people in their own comfortable way because they're speaking their own language to you. I think that's a real gift. So thank you so much. Speaking of that, I'd like to thank the Spanish interpreters. I know how incredibly difficult it is to do simultaneous interpretation. That is truly another kind of gift. So thank you all. I don't know if our interpreters get thanked enough for all the work that they do for us, but thank you very much. Thank you, Giovanni, and everybody else who helped with the techno stuff. You guys are another kind of magician. I really respect all the work that you can do that I can't ever figure out how to do. Ashley Michelle, thank you so much for organizing and putting everything together. I know that was a lot of work on all your parts here. So yeah, big round of applause to everybody who is involved here. I just want to say then in closing remarks that, you know, I hope these 2 years of the Kugel Zuroweste Award are just the beginning, and that we can continue to identify and celebrate rising stars in healthcare in the next couple of years. This is a very good start. Like Ashley Michelle said, strong candidates here. And I'm really excited about the future. I sometimes have a really hard time with looking at the news today, but seeing the young generation of clinicians coming up makes me feel optimistic. So thank you. Thank you, everybody at MCN also for all the hard work, and all the other NGOs who do this kind of work. It's really important, and it's to help build strong networks of communities of people who have the same kind of goals, and bringing health justice, I think, to a world that surely needs it. So thank you all. And with that, I would close, but again, we have time here. If anybody else is motivated to say a few more words, that's fine. Otherwise, I will close this and close my role as MC of this ceremony. And if I'm lucky, they'll hire me again next year to do this again.